the ECGs which were read abnormal by the AI. So we had to confirm that yes, this was the very early times. So the people did not rely that much on the AI. So what was considered normal was accepted as normal, and but what was considered abnormal had to be scrutinized by our input. So that's how it worked. Then gradually it has taken over the functionality of reading echocardiograms. So anything with image analysis, the AI is extremely good.
Yeah.
So, and repetitive and a structure analysis or image analysis where you have to discern a minor difference. So it has got a great role in CT scanning or in X-ray analysis or in echo analysis, because these are repetitive patterns, and if it is excellent in repetitive patterns, so it can very clearly discern and many times better than human eyes. So that is the uh, fortunate or unfortunate part, but I think it is fortunate part because accuracy has increased. So that's where I am in.
Yeah. Okay, so shall we start? We have from the participants, we have very few right now. I don't know why there were. We normally have about 10 people participating every every day. Any idea, Amitaji?
Not sure. But by any chance, are they waiting in the waiting room? Remember
No,
last
no,
time?
no. You know, nobody's waiting. Yeah, that's what I'm saying.
Okay. Let me send reminder in the group.
Yeah, please. Okay. Anyway, we are having the recording, so we'll
Yeah.
be sharing it. I think we can start,
Sure.
right?
Yeah.
Yeah. Okay. So just in 10 minutes, actually, there is the topic for today's discussion. Originally was uh, uh, for mental health, as but then today that part I'll just go over a few slides of what I wanted to discuss over there. Another time we will have a more detailed discussion. And today let us focus on uh, the cardiac patients, which Dr. Vardikar will talk about. Okay, uh, I'm sharing my screen. Yeah, okay. So today is our seventh session. Uh, we are going to cover mental health and the cardiac health, 2 points. Uh, Under mental health comes everything, including uh, sleep, meditation, spirituality, also uh, stress and things of that. And cardiac health, we will actually go through our standard process that we follow for uh, AI in any healthcare area. So according to that, I mean, the way we are proceeding is we first have a patient. We use AI to create a patient's guide, which will give all the steps very detailedly elaborated with respect to that health condition. Uh, then we look at various different symptom checkers, the apps which can capture the symptoms, and also all the data we have already collected in the before we started this. We collected all our health related data from all the different sources, including the data available with the hospitals, with the labs, and X-rays and MRIs and everything that is related with our health. All that data we have already collected, and then we make all these symptoms as well as this data available to AI. AI generates a referral for the doctor, which, I mean, from the AI's perspective, it will analyze all your health data, and it will try to provide you with provide its analysis to the doctor for giving for the such a letter we can take and go to the doctor. Then the doctor will do the diagnostics and define a treatment plan. Doing this itself, the doctor will have his own AI tools to do some more work. Uh, and this is something which, I mean, we are not including it for our patients to much on that, because this by by legal issues are involved in case you try to use AI for diagnostics purposes. And then once all the treatment plan has been prepared by the doctor, then you can use again AI for creating a lifestyle modification plan. This lifestyle modification plan can further be used by AI for monitoring and creating alerts and controlling your whole uh, subsequent actions on that. So we will be looking at for cardiac specifically. We'll go through all these steps, and uh, Dr. Vardekar will be able to explain us at these stages what it. So uh, this disclaimer, as usual. Uh, I'm not a medical professional, so all we are doing is just looking at as a patient's point of view, how AI can be used. That's what we are doing. Okay, so AI for mental health. Just a few things I wanted to check out that mental health, because seniors often experience loneliness, anxiety, etc. There's a cognitive decline. There's a mental health. Uh, General mental health will include overall well-being. So all I need to explain this. Uh, how AI supports mental wellness, where exactly AI helps in mental wellness, is you can have tools for doing mood tracking and journaling your all mental health related. Uh, uh, then you can use virtual chatbots so that people who are feeling very lonely, they can actually the virtual chatbots can actually work as their companions. Uh, in meditation and sleep, there is a uh, very nice tools available with the AI and general online technologies. And then for for memory improvement, or keeping track of games, etc. So all these things are the ways in which in mental health it can contribute. So for that, these tools, a few apps we have considered here that we can use. We will not go in detail right now, but this is something what. Uh, okay, there's a lot of echo coming. I'm not sure what is happening, but anyway. Uh, okay, so yeah, I think echo is reduced. All right. So we will have another session when we'll actually go
Hi,
through the.
I think
so
somebody
sorry.
has cell phone and laptop both on. That's why there is a problem.
So if everybody else mutes themselves, then it may be less echo. I'm going to stay muted.
Yeah. Yeah, I think it is reduced, right? Yeah, I think. Yeah. Okay, good. So we will have this session another time, but actually we would like to give a demo of all these all these I think 6 or 8 these 6 different apps of how it can be used. They're very simple, easy to use, uh, and can actually. There are many times very simple things which actually become very useful in treatment. So these are things, but this will have another session for looking at it. Uh, I also wanted to show you something that our Mani Bandari and Rohit Bandari, they have prepared using AI tools. This is for a wellness AI assistant, and Rohit has already uh, joined our discussion today. So, Rohit, you want to quickly give in 1 or 2 minutes time what is this
Sure,
tool?
sure. Yeah. Thank you, Ashokji. So, I mean, I mean, so what is the inspiration about this? So, actually, in my own organization, we are from the corporate world, and there's a lot of emphasis on mental well-being because a lot of people nowadays are on stress. So, what we thought of was because given that these, AI models, these can be trained actually on some of the Ontario curriculum for wellness. And we took a complete, I mean, if you go to like this website, this is wellness dot, I can put it on the chat. It is wellness.aiempower.ca. And therein you can actually go in and look at, if you click on the about, you will see what all material this has been trained on. Now, secondly, what we added was this has a very calm voice. So the way it does is it tries to do more listening
Mhm.
than talking. And this could be used for somebody to even, because this is not a human, right? So you can vent out your, like whatever, sitting inside you, whether it is
Mhm.
frustration or
Yeah.
whatever you have, you can actually throw it out at it. And secondly, what we are doing is we are also, given that this is a very, sensitive situation, so we are not recording any of the things. So it is free, first of all. It is free for all, and we are not charging any money for it. Anybody can go in, talk to it, and open up like you're talking to a counselor, and it will guide you through the Ontario's like 4-3-2-1 method and various other methods to guide you down and calm you down. So I remember last time, like, there are few people who asked questions about sleeping disorder, anxiety, those kind of questions that you can go and throw. And don't worry about any of your name or number or anything. You don't have to give
Doesn't
anything.
ask. Yeah.
Yeah,
Yeah.
so this is all about it, but it's very easy to use. I'll put that in the chat, Ashokji.
Actually, I have already given the link in our workbook. So
Okay,
for,
perfect.
for this week 7, whatever I have shared with you, in the workbook there is one task of going through this app. So please check that out. Very interesting to look at it, and you'll see you'll get an idea as to simple things, but how useful they can be in your health. Uh, okay, so benefits, yeah, it's quite obvious. I think I don't need to explain on that. And finally, it was very interesting. I mean, this is, of course, AI itself is telling me when I was exploring all these things, AI itself told me that actually you require a 4-week program on just AI for mental health. And I think it's a very interesting thing to think about. Uh, so depending upon where is how much interest, we can actually put together this 4-week program with these things. And to start with that, uh, I'm creating one WhatsApp group for AI for mental health, and let's start discussing the possibility of doing this 4-week program. So with this, I will stop discussion about mental health, and let's focus on our main agenda today. Uh, so cardiac health for deep research. And here, uh, I have already talked to you earlier about uh, the various different steps that we follow for exploring any condition, any health condition. And it starts from first, we we are creating that a guide, a patient's guide, which is a detailed analysis of a particular test. So, for example, over here, for cardiac conditions, I mean, we used AI to create a complete guidebook, uh, which is some 20-30 pages kind of a guide that it has generated, that how you would be able to use AI for your cardiac conditions. Once then further to that, we add all our personal health data, and this is called retrieval augmented generation. That means, we augment the available information with some additional information. That additional information is everything about our health. So we have gone through initially, I think almost 5 weeks we spent on simply identifying where our health data is available, and then how to extract that and then bring it into your health repository. So all that we have seen, and then uh, also how to use the symptom checkers and digital watch and Google Fit and BP and sugar, all these things, how we can regularly go on capturing that data of symptoms, and then we put all this into the bucket for the AI, and then based on that we create AI referred uh, document to the doctor, which says that, okay, this is what AI thinks should be happening, and then the doctor will do the diagnosis treatment. This is something which I have already described. Then lifestyle modification prescription, then a day planner, calendar, monitor, alerts. This becomes a typical process for any medical condition. But today we are going to discuss with Dr. Vardekar specifically the conditions about cardiac patients. So with this, let's get back to uh, Dr. Vardekar and talk about this. So
Okay, what I'm going to do, instead of giving a didactic lecture,
yeah,
I got an impression that you people might have a lot of questions on this issue. So if you have specific questions in this issue, we will I will try to answer to best of my ability. I have to give one disclosure that now I'm retired because I'm just 86 years old. So I am not able to prescribe or advise or even express medical. I can express generalized medical opinions, but I cannot answer specific issues or specific question of an individual, because I am not allowed or I am prohibited by law, basically. In AI, as a doctor's perspective, I have only two things which come to my mind: that there is a glut of apps and glut of wearables which are available on the market.
yes,
How we have to first of all decide the reliability of each app or each wearable. And they have been, like, for example, from like Google Watch. So Google Watch, or with ECG attachment, from generation 4 onwards, it has been approved by FDA. So once it receives an FDA approval, then you have a mark of approval, of generalized approval, that okay, it has reached an acceptable level of accuracy. So that is, we have to notify our clients, or whichever clients we are dealing with, about which are the most reliable and FDA approved app, or approved app from the generalized, from the scientific point of view, that they are reliable. Secondly is the issue of privacy, because this is very sensitive data. So there is always a question that when you are putting something on the net, the question comes of the that it should not be leaked or should not be available to anyone else or to anyone else eyes or ears, because privacy is of utmost importance, particularly leading to uh, uh, leading to uh, 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 medical issues. And, and lastly, that I find that the apps are being used by young generation, and the young generation actually does not need those apps or does not need those wearables. The wearables should be used by after a certain age, or people who are known to have certain specific problems. If they have already developed, even when younger, they have developed a certain issues. And if they have developed certain issues, then you have to make sure that they are using the appropriate app for that particular area. So issue is reliability of the app, second is the privacy of the app, and thirdly, in what way it is going to aid. Now, one idea which came to my mind was, when the patient comes to me, many times I have seen that the patient comes to me and starts rambling. Rambling means it starts rambling that I started from my home and I was wearing my tennis shoes. No, no, no. I was not wearing my tennis shoes. I was wearing my regular shoes. And then I took a cab. No, I didn't take a cab. Actually, a friend came and he picked me up and he dropped me. Now he has spent 5 minutes and he hasn't told why he has come. So the doctor is paid $35 or $37, 57 cents for your one visit. And if you expect him to spend half an hour with you, it is not going to happen. So because he has to, and there is overhead of 55% in Ontario. So so basically he is left with $17 in his pocket. After that he pays income tax on it. So hardly he the time which he is going to allot you is a small amount of time. And that's why if you are to the point, so we thought of an idea that if we use an app which will create a proper history, and he either prints it and takes it with him so that he can read out, so he can be concise, and he will save his time, and at the same time he will save the doctor's time. And in that way the doctor will you will extract much more from the doctor as compared to just rambling and the example which I gave you. So these are my thoughts, and I thought that this was a good idea. And in this one, there is not much of a medical legal aspect involved, because whenever you are suggesting a app for a healthcare, there is always a medical legal. Suppose the app tells you that you have got only 5% chance that you are going to get a heart attack, but you got that heart attack when that's why the app said there's no need, you can see your doctor tomorrow, and you got a heart attack in that evening. The person who suggested to use that app becomes also liable. So that is the reason we have, in this way, all you are helping him is preparing a proper narration and history, which includes his family history, his background history, his past history, his history of any allergies, his history of any medications which he's taking, and what doses he's taking in. So it becomes a comprehensive presentation and a short presentation of, and for why has he actually come, what is bothering him for which he is seeking the medical attention today. So if we can help him to properly present these thoughts to his treating doctor, his life will be easier, the doctor's life will be easier, and the patient will get much more out of that doctor as compared to if he just goes and
Yeah,
rambles.
perfect. I mean, this is a very good thing about what patient should be doing before going to the doctor. This was
Right.
very nicely. In fact, there is we have with us Rohit. Rohit used. I mean, he's an AI expert himself, and for his heart purposes, for his heart problems, he recently actually. Because he was using this ChatGPT and other tools, he could quickly identify what the problem is, and he could very quickly maneuver through that. So, Rohit, do you want to just add in a couple of minutes your experience with AI in heart condition?
Using AI. Yeah.
Yeah, sure. I mean, I can add few observabilities here. So see, I mean, I was anyway initially also a little bit educated about what are the symptoms and how it happens. Like, and I had this partial blockage which I never was aware of. And being a South Asian, you are also in a predisposition of genetics to or hereditary to have these incidents as well. So on a particular, like on a eventful night, I woke up and I had little bit of chest pain which could have easily ignored, right? I could have just said that it is a gas burn or I had a late dinner or whatever. But what I did was because I had this chest pressure, I thought I'll put it onto one of the AI agent and see what it has to say about it. So I gave all my symptoms, all my age, um, my previous test results, things like that, and it narrated very well, what it could be, and it told me to try a few things, like based on my severity, because I was like still stable, right? I had no breathlessness, I had no dizziness. Even I tried to take a walk, everything fine. But when I, pushed my observations onto the AI, it the very first thing it told me, like, we need to rule out, right, certain things. The first thing is cardiac, right? We need to rule that out. And it even guided me, like, what is the best way to do it. Like, it told me to pick up your phone, call 911, and it even told me, like, this is the charge they're going to do, this is how you're going to navigate it. And based on your condition, he told me, like, if you are feeling very severe, you can take aspirin and things like that. He just guiding me all the way through. So it was like a partner to me. And I feel blessed in the sense that because I mean, unfortunately, I was alone at that time.
Yeah.
My wife has gone to India, so it's a situation which people can easily ignore, right? They can just think about it and forget about it. But yeah, having said that, I would say, like, I would totally encourage, of course, don't blindly follow AI. That's another key thing.
Yeah.
But
Yeah.
whatever you get input from it, you can then call 911, figure out whether these symptoms are making sense or not. But that's what I did actually. I went to the hospital, tried to do, because they told me, if you are very confident of yourself, then just go and do a simple ECG to see how it is. Yeah.
So actually, this was a very good point. How to really use AI as your companion. That's a very key to it. And the second other important thing what Rohit has mentioned, which of course Dr. Wadekar has been very much emphasizing, is that understand its limitations. I mean, uh, because there's a very good possibility in which Dr. Wadekar explains very nicely about that. I mean, people will get panicky because they just saw that their blood pressure has gone up, or heart rate has gone up, and suddenly they will get panicky about it. Actually, there is nothing wrong in that. Once in a while it can happen, but this understanding, getting to that level of understanding that okay, AI is giving you some information, but that also you still have to have some more sanity around that. And if you can't have that sanity, go consult a doctor and then get understanding.
And just to give you an example, that even when you go to the emergency room and the doctor listens to your story and does it sounds very atypical, and you are a comparatively younger patient, the doctor says or tells you that he doesn't suspect that it is coming from your heart, but just the same, I will do an ECG. It is more to save his tail, basically, because he wants to be on objective data. So what he does, he still does an ECG, and then he has documented that okay, your ECG looks fine. So now your history was atypical, as well as the ECG is normal, so there is nothing to worry about. So in spite of all these things, the doctor takes that extra step, even when he is suspecting that 5% chance that your pain is coming from your heart, he will still go ahead and order an ECG and do an ECG, and based on the subjective data which he has collected from the history and his examination, and the objective data, that is the ECG is normal, they also do some blood tests. So they take an extra step. So in the cases, if when you see, always look at I looked at lots of AI, and they said that if your symptoms are such and such, such and such, such and such, don't even bother looking at me, but just go and consult your doctor or go to the nearest emergency room. So can we define certain parameters which are mandatory, that you should not waste your time? And this is what I wanted. What we were doing is Himanshi was helping me to review various scenarios in different age group with different cardiac complaints, and she once I get the report from her, and she was using ADA because that is a primary history taking app. So she's using ADA, and then I'm trying to find out, once she submits me those reports, what are the holes in it, or where did it miss, or or does it need any improvement, or why reinvent the wheel? If it had answered all the questions in a proper fashion and identified the issue, then we don't have to. We can just tell that if you are having any symptoms, use ADA to make a diagnosis, or create a history for yourself, so that you can tell properly the treating physician whom you are going to see. So that's the stage which we are in right now. So we are trying to evaluate the existing apps and to see whether they fulfill the requirements as of now, or do they need any improvement in it or any addition to it. So that is where me and Mr. Ranade are at this stage of the game. So now if you have any specific questions about any issues, then we can answer those.
Just one more thing I would like to like you to talk about is once this kind of information patient will bring to you as a doctor, then of course you would proceed with your own ways of diagnosis and treatment.
Yes. Yes.
So if you want to say something about
Sure. See, the first thing which we the old medicine, because I am old, So I still follow the old medicine. So the old medicine was, first is what the we ask the patient to describe his issue or what he has come to see me for in his own words without giving him any leading questions, which AI may tend to do a slightly more than what we would do. We tell you, tell me in your words what is bothering you, and so what are your symptoms. That is called as symptoms. That is, symptom is nothing but patient's own description of what the problem or the issue which he is facing. Then, once that symptom is described on the basis of the history or that symptom which he has been describing, the doctor comes to some conclusion, and then he examines you depending upon, like, suppose you are having a pain in your head. Because he has limited time, he may not examine your abdomen because you are complaining of a headache or you are complaining of a chest pain. Then he is not going to examine your leg because the complaint is in the chest area. So on the basis of the history, he makes a diagnosis which system or he has to examine first. It doesn't mean that he may extend his examination to other areas, other relevant areas, but so once he has the symptoms, he then decides which organ he needs to definitely see first and the ancillary areas. Then he comes to this conclusion from the examination. The examination confirms his impression of his history. So the history which the patient gave, first that gave the doctor an idea what he may be dealing with. On the basis of that, then he examines it to confirm what he was thinking on the basis of the history. And then the third step comes, that he orders certain tests to confirm his impression from the symptom analysis and from the examination. Nowadays, lot of people, lot of doctors do not follow this. They say it is much more easier for me to do a chest X-ray than to listen to the chest, because it takes me 10 minutes to listen to your chest and it takes 2 minutes to do a chest X-ray, and one look at the chest X-ray tells me a lot much more, or an ECG tells me much more that you are having a heart attack or you are not having a heart attack. So, but I still believe in the old method and its validity, that you should first take the history, that is what the patient is telling you, then examine the relevant system and the adjoining system which needs to be examined, and then order the test, so that superfluous tests are not ordered. Because many times what happens, they say, oh, you have abdominal pain, let us do an ultrasound, instead of examining you and saying which area he is suspecting as could be the issue. He orders an ultrasound and then he finds some smaller abnormality in that ultrasound, and then he's chasing the ghost, because now he has to explain that what is that abnormality which is being reported in the ultrasound. So things have gone astray a little bit, but they can be brought back into the focus, and the AI certainly can help in that direction, that it will get a proper history presentation to the doctor. On the basis of that, he can then shorten his examination to the system involved, and which will aid him into which test to order. So um, you don't waste time, and you don't means he may order an MRI and the MRI takes 6 months for you to get
Yeah.
get done. So you are waiting 6 months, just thinking, what may be wrong with me? What may be wrong with me? What may be wrong with me?
Yeah.
So that is the issue with the present problem, and AI will help in properly focusing the history and then directing the doctor. So this is how the system works. This is how the doctor's mind works. How he comes to the, if I answered your question, how he comes to a conclusion, what may be wrong with you on the basis first with the history, then he examines, and then he orders the test.
Yeah. Okay. Great. Yeah. Okay. The next part that I wanted to check with you was that uh, actually a lot of things really depend upon your lifestyle modification, and that quite often does not get adequately addressed in the existing system. Perhaps, I mean, doctor will tell you that, hey, you should reduce this, you should add this in your diet, etc., etc. But it doesn't get so systematically monitored and controlled, which probably AI may be able to contribute in terms of, first of all, being able to give you a complete uh, uh, lifestyle modification plan, uh, which can be a lot more elaborate and detailed and very individualized, because AI can have very specific individual information about the person, and that is based on that it can actually create a lifestyle modification plan which is very specific for a, and uh, in that area, uh, do you feel that there could be some additional improvements in the results?
Yeah, definitely, because what happens that uh, there is a dramatic increase in the non-communicable diseases, and there is a decrease in the communicable diseases, that is the infectious diseases. Tremendous, apart from that COVID epidemic which we had, majority of the time we don't get pandemics anymore.
Yeah,
We used to be plague pandemic
yeah,
and this pandemic and that pandemic, but we don't get that anymore. Uh, so AI can help in specifying what lifestyle modifications you need. There are two kinds of lifestyle modifications which are needed. One is general modification, and second is specific to your issue. Like
yeah,
if you are a diabetic, then there are certain definite lifestyle modifications which are indicated for you. If you are overweight, there are certain lifestyle modifications are needed for you. If you have a kidney disease, there are certain lifestyle modifications are needed for you. So answering that lifestyle modification, that okay, based on the history or the based on your diagnosis, the the specific AI which you need, a specific lifestyle modification you need are these. And secondly, generalized lifestyle modification. Uh, these are these which everyone should do. For their mental peace, for their longevity,
yeah,
for
yeah,
their general health well-being,
yeah,
or general well-being, both mental and physical. Like for example, we everyone hears all the time that we should exercise, we should
yeah,
exercise, but how much exercise, and what exercise, and which kind of exercise. And then the AI also can help in determining when you have not done, and that's where the variable comes in. The
yes,
variable helps you to determine that did you walk that much. You were supposed to walk, say, 1 mile. Did you walk 1 mile that day? And the AI tells you, no, you didn't walk, you walked only half a mile. Okay, there might be a good reason that your knee was hurting, or whatever the reason may be, that you didn't walk. So, but you are made aware that you fell short on that particular day, either in your diet or in your exercise, or you missed your medication. So AI keeps a track and reminds you, puts a reminder in the evening that okay, these are the things which you have missed out. So there is a big role of AI in maintenance or in the follow up, whether the patient is doing what he was told, uh, the way to modify his or her life. So I think AI has a role, a big role in suggesting, number one, and number two, in follow up, whether the patient is doing it or not. And then, like, we use glucometer. I'm a diabetic, so I use glucometer, and that glucometer report directly goes to my health clinic directly, because it is synced with their machine. So once I do a blood sugar, they will call me that your blood sugar wasn't good. Or what happened? Did you eat something dessert or extra dessert or whatever happened? So they start questioning me because the AI has sent the glucometer report directly to them. So there are ways and means by which there can be a superimposed monitoring done by the treating physician based on the AI use that the report was sent to him
Yep.
of my blood sugar that done on that day. And I have to, because the glucometer tells me to enter whether it was a fasting blood sugar or whether it was a 2 hour postprandial blood sugar, that is after eating. And on the basis of that, if they are not within the norms, the clinic calls me and tells me that what happened, or they ask me this question, or should I be giving you an appointment earlier because your next appointment was 6 months, but under the circumstances your last 2 3 readings have been out of whack, so I think we should see you
Earlier.
earlier. So this is the proactive nature where the AI helps, and AI being is being used by even me even at this stage for just managing my diabetes.
Right. Okay. Yeah. So actually, this is where, I mean, one more thing I would like to mention. When we have been always talking about this AI agent part of it. So actually, what will happen in future? This is the vision that the AI world has, that uh, the doctor will have his own AI agent, and the patient will have his own AI agent, and actually these agents will be able to talk to each other.
That is what is happening here.
Yeah, exactly. So this is something, what is the future of AI usage of this.
And the main doctor does not look at these
Yeah,
reports, but what happens that he has minions. So
yeah. Right.
so those minions look at those reports, and then they call us
Yeah,
that your things were uh,
yeah.
not in line. So I think you should have an appointment earlier than 6 months, because the
Right.
last 4 readings have not been
Yeah,
where it should have been.
right. Yep. Yeah.
Ashok,
So
Nalini has hand up. She wants to ask something.
yeah, yeah.
Hello.
Nalini, please.
Hi, Dr. Vadik. I have a question. I'm really sorry if you have already mentioned about this. I have a strong family history of heart. My dad died of myocardial infarction, and my mom had bypass surgery at the age of 56. So I'm very prone to this. Is there anything I can do otherwise differently apart from my or do AI consider those things as well?
Yeah, the first of all, when anybody who has this very strong family history, I usually advise them to score their risk factor. So there are various, and the easiest risk factor, which I usually tell them to start with, is the Framingham risk score. The Framingham risk score tells there are, and it is very easily available. It is, if you Google it, you will find Framingham risk score. So I tell them that first score your risk, and if you are found to be intermediate risk, or and how they define the risk is, the Framingham score defines as less than 10% is called as low risk of having chances of you getting a heart attack in the following 10 years. So it is not that tomorrow you are going to get a heart attack. It is less than 10% chances of getting a heart attack in the following 10 years is called as low risk. The between 10 to 19% is called as medium risk or intermediate risk, and above 19% or 20% plus is called as high risk. So I tell them, anybody who has the family history, that do a favor to yourself, score yourself on the Framingham score. Those who are, the Framingham score unfortunately does not have ethnic background or family or genetic background like what you are describing. There are two other scores which are, which include that part, and if you are interested, I can send those links to Mr. Ranade, and he can forward it to you. These are available on Google, but they are specific, that they include the genetic aspect of it also, because the Framingham score was done about 30 years ago in a large scale study in Framingham, in England or UK. So that Framingham score is a starting point, but usually those who have got only a strong family history, or like we Indians have got what Rohit was saying, that we Indians have got more propensity to get heart disease earlier. There are many reasons for it. We won't go into the details, but there are scores which take into account. So I will pass it on those score sheets
Sure.
to the links to the score sheets to Mr. Ranade, and then he can forward it to you.
Yeah.
Thank you.
Actually, one more thing I would like to add at this point. Uh, uh, actually,
So I would suggest that anybody of Indian descent, once he has crossed age 30 or 35, he should do a scoring on himself to find out whether he is in the intermediate group, high group, or less group, because based on that they decide what precautions you can take so that you don't come up with a heart attack. And there are certain, even the Framingham score tells you when you should start aspirin, when you should start statin, uh, at what risk level you should start statin as a precaution. You didn't have a heart attack, you don't have hyperlipidemia, but they, if you fall into that intermediate risk group or in a higher risk group, they suggest there are certain parameters that you have to do to prevent you from going into that phase or suffering a heart attack. Like what Rohit was saying, if if he was aware, or I don't know whether he did his scoring before or not, but if he did his scoring, he would have found out that whether he falls into the high risk group, medium risk group, or low risk group, and then it would have put his mind to ease, and he could have acted upon before he got his whatever he suffered from. Before that, he could have acted upon that prevention, which has been very properly given in those risk scores.
okay. One more thing I would like to add here is,
Does that answer your question? Okay.
Sorry, I'm it. Yeah, definitely. Thank you so much.
Okay.
One more thing I would like to add here is Rohit has actually shared the link to one documentary, and I really found that documentary very, very interesting. It's a long documentary, it's more than 2 hours, about the name of the documentary is Brown Heart. Brown Heart. And uh, I mean, it has described so nicely so many things about Asians, particularly South Asians, and about their heart problems. So actually, in our workbook, I have already put that link to that particular documentary. So if you have time, you can actually go through that. Yes.
Yeah, because in India, the incidence of coronary artery disease is dramatically increasing, particularly because we have our diet is those who are vegetarians is predominantly carbohydrate, and we tend to be um, overweight, tend to be overweight and less physically active. Majority of women, I see them when I see a Indian woman walking with like cross leg. I said that she has developed arthritis of her knees because of her weight. So, so it is very, very common, and that is the reason. That is one of the reason why they, because of the inactivity, overweight, and extreme high proportion of Indians are diabetic, and because of all these, the incidence of coronary artery disease in Indian is extremely high, very high.
Yeah, yeah, Amitaji, your
I have
hand
a,
is raised. Yeah.
yes, I wanted to touch slightly on a different area. So, Dr. Vadekar, what you shared was phenomenal, like very helpful to understand. But one issue that I find with this Canadian medical system is getting the right tests written or prescribed from the doctors. So sometimes the ranges are normal, but the body is giving signals or different symptoms that I want to get tested on, like different markers, but doctor wouldn't write that test. She would be focusing just on that symptom. As you said, like if you go for headache, they won't talk
Yeah,
about
they won't focus on your abdomen.
right. But if you tell there are some linked symptoms, like specifically I'm talking about the thyroid, like T3, T4 are normal, but TSH is slightly elevated. I asked her to get my antibodies tested. She would not write it. And I was talking to my naturopath, and she said, your other symptoms like hair fall and all, they do indicate you might have subclinical thyroid, but she wouldn't write, right? And they do not look at holistic picture. So that sometimes really worries me that they ignore the key elements of the healthcare, right? I have 5 symptoms that tell me that there could be things out of balance, but she's not writing the test because their studies have simply taught them not to, or it is not covered in OHIP, or it would put a load on OHIP, right? So how to handle those things? So I think AI is helping me, guiding me that yes, there could be underlying issues, but doctor would not agree.
Now, coming specifically to your issue of thyroid, usually we go in the treatment of hypothyroidism or diagnosing hypothyroidism. We usually go by the levels of TSH, because what happens is when your thyroid is not producing enough thyroxine, or T3 and T4 thyroxine, then what happens? The pituitary is stimulated because pituitary controls the thyroid, and that's why the TSH is a hormone which is coming from the pituitary. So the TSH levels goes up, and there are certain parameters which are told to them, or taught to them, that unless the TSH reaches a certain level, they are not, like, for example, for at my age, the acceptable TH level is, which is abnormal by 2 times the normal range. The normal range is between 2 to 4. But my TSA, my doctor, endocrinologist told me that I will not treat your TSH level unless it reaches above 8. So it means double. So that is, but those are the parameters that has been his experience, that by giving me thyroxine, he may be causing me more issues than by not giving me thyroxine. And that is the reason, because they have their guidelines, and their guidelines says that unless your TSH at particular, after a particular age, reaches 8 plus, then only treat. And they are, because if they gave you something and you develop side effect of that thyroxine, you will say, you will ask him the second question, that what was the level you were taught to treat. And he said, no, you were supposed to treat only when it reaches above 8, and you started treatment at me at 5.6 because it was slightly higher. Why did you do that? So that is the reason that they don't go there, because they have certain parameters. But in case you think that you are justified and you want to know that particular piece, like you want to get that particular test, my suggestions will be that if the doctor is not listening to you, and it means she is not receptive, basically. Because majority of time, when a patient requests me that I want a particular test, unless that test has its own, and it is a simple blood test, like doing an antibody, as you are asking, anti-thyroid antibody, that doesn't help me in making the treatment, because I'm not going to suppress your antibody by giving you steroids, because the treatment for that will be suppress the antibodies so that the thyroid can become active again. The replacement is a much easier way of compensating for thyroid, because it has got minimal side effects. And that is the reason that the antibody test only helps you in diagnosing that you have Hashimoto's thyroiditis. That is an autoimmune cause. So it will identify that you have got what is the cause of your slightly underactive thyroid. But it doesn't tell me still to treat you, because whether you have what it is due to Hashimoto's disease or whether it is due to age, uh, the treatment remains thyroid replacement. And they have parameters set in their books, if they are knowledgeable, that at this level we are going to treat, and at this, below this level, I'm not going to replace the thyroid hormone. So for each set of age group, there is a set parameters. So knowing that you have Hashimoto's thyroiditis doesn't help you in any way, except it doesn't change your treatment. It only changes that now you are more aware that what is the cause of my underactive thyroid. It is Hashimoto's disease or autoimmune thyroid disease, because the antibodies levels were high.
That's
Did
right.
you get it?
Yes, thank you so much.
Yeah, Krish. Krish, you're mute.
Okay, I just want to thank everybody. Thank you for the meeting, and thank you, Dr. Wadekar, for your excellent talk. I can relate to everything that has been said because I've had an angioplasty, and I also have thyroid.
Yeah.
So I can relate to all this. I've joined this group very late because my friend Ashok Ranade, I just saw the first email today. I'm wondering what happened to the other six. Today is the seventh session. Anyway, but
I'll be
I'll
sharing
get
the
to,
recordings.
I
I'll
have
be
to
sharing the
leave.
recordings to everyone. No problem.
I
Yeah.
have to leave the meeting right now
Yeah.
because I have guests in the house. But thank you very much for this opportunity, and much appreciate all listening to you, Dr. Wadekar, and also to the everyone who has asked these questions. Also, thank you very much.
Thanks, Chris. Yeah. Okay. So uh, anyway, I think we have mostly covered our agenda. There are two other points on the agenda. Was we every time in every session we look at what are the tasks pending to be done, and uh, uh, we just check out of what is the place. So on that, I'll just in 1 minute I'll just
I think there's a network glitch, right? I'm facing.
Yeah,
it.
it looks like
Okay.
it's frozen.
Yeah, thank you.
Yeah, we lost him.
Yeah. Maybe he's rejoining. I messaged him, but he hasn't responded yet.
Anyway, Dr. Ashok, this is Anita here. So you have clarified so many doubts what we are thinking about why doctors uh, don't tell more about what we wanted. So the limitations we don't know. So we'll be thinking like if it is in India, we can go to another doctor like with all our prescriptions or all our data. But here, because we have to move to the other doctor to clarify our doubts, second opinion. So today you clarified so many doubts, whatever we are thinking in our mind, and we didn't had all the answers. Thank you so much.
You're welcome.
Yeah.
Yeah, the problem is, see, there are two issues. One is in India, you pay for everything.
Yeah.
Here, everything is free, and because it is a governmental responsibility of payment,
Yeah.
and government has restricted or tied doctor's hand that you can do this, you can do that, you can do that. What I want to emphasize is Canadian medicine is excellent as long as you have an emergency, but it is not satisfactory for chronic diseases. Like if you have got a low back pain or you have got a pain in your belly, not belly, but in your pain in your knee, and you need an MRI, it may take 6 to 8 months to get an MRI. But Rohit will subscribe to it that if there was an emergency and you need an immediate uh, bypass surgery or an angiogram or an angioplasty, it will be done right away at par with any other places. My own example, that when I went to the hospital with abdominal pain, they immediately took me, and I didn't have to wait. They immediately took me, did all the relevant tests. It took 2 3 hours for me to get the reports, but they acted upon it because it was an abdominal emergency, which they thought it was an emergency, and they did all the tests which was necessary, which were done, and on the basis of that they decided that I need admission, and they admitted me, and after 3 days they discharged me. That everything subsided, fortunately for me. So Canadian medicine is excellent as long as emergency is concerned. If you require emergency medical care, it is excellent, and I will encourage you to reach the emergency room more often. And if you are suspecting that you are having a cardiac issue, don't waste your time by calling your doctor or going to a walk-in clinic or going to a GP's office. It is better that you go to the emergency room. They evaluate you, because if you have come with a complaint of chest pain, they will evaluate. You are put in, there are three ways they prioritize you in an emergency room. Number one is you are in a green list, yellow list, or a red list. If it is a red list, it means you have got, they are suspecting that you are having a life-threatening condition. So in those cases, they immediately act upon that, and they take you in much faster. Unfortunate part is that after that you reached at 5 o'clock and you were categorized as a green zone. That means you can wait. It is not a life-threatening condition. Unfortunately, after that, five more patients come who are in the red zone, who require immediate attention. They will be given the priority. So they are given priority on the basis of the medical condition which is suspected. Is it life threatening or is it not life threatening? So even though you have come at 5 and somebody has come at 7 and his medical condition is categorized as more life threatening, he will be looked at first and he will be investigated first, and you will still remain on in your sixth or seventh in the line. So that is the issue, that if they when they are categorizing you, they triage you. The nurse triages you based on your complaint, and if your complaint is pointing that it is not a life threatening situation or is not an acute emergency, you go a different route, and then your wait time increases in the emergency room. And that is where people don't understand that I came at 5 and somebody came at 7 and he was still seen first before me. How come? I came 2 hours before him. But that is because his diagnosis was that he had more pressing situation, and that's why he was taken in. So I just wanted you to explain it to you, how the triage system in the emergency room works and why there are delays even when you have come earlier. You are not seen the first.
Yes, yes, we understand the system. Yes, that's true. But not only for the cardiac, so we are advised in the beginning when we are moved to Canada. So some of the local people were saying, like, instead of going to the family doctor, if you have any tummy ache or headache, if it is really like more, we can just walk into the emergency.
Yeah, it is because that they will be drawing their attention that okay, you may have acute appendicitis or
Yes,
something
yeah,
like that,
yes.
and then you will get much faster responses, because they are thinking that something needs to be done, and
Yes,
something needs to be done urgently. And
yes,
so you have in that zone system, that three
yes,
zones which they create: yellow zone, green zone, and the red zone. You have gone into the zone which has the priority, and that's the reason you are seeing faster and actions are taken faster. So unfortunately, that is the bottleneck, and things can be better, but there is a lack of staff. And then what happens that, like in my case, they ordered an ultrasound of the abdomen, and it took them 2 hours to read the ultrasound, because the radiologist was in another emergency room. He was supposed to come at 5 o'clock in the morning to read echoes done in the emergency room. So it is a tremendous shortage of trained people and the finance. These two are making the bottleneck for things which can be improved. It is not perfect for chronic diseases, and it is not perfect for not life-threatening diseases, but it is perfect for acute emergency.
yes. Thank you so much, sir.
Uh, yeah, my apologies. My system got disconnected. I could not while I was speaking. Uh, so anyway, just wanted to add a few things because we are coming to end of our time. Uh, the follow-up things that were expected from all participants that that is given in our workbook 7. Uh, One important thing I wanted everybody to do was to fill in that form, which actually asks you to say which apps you have installed, whether you have created your data extractions, etc. So please fill up that form. That gives us an idea as to where exactly we are in terms of building your AI agents. That is one thing that I wanted to mention. And apart from that, if there are any more questions, please go ahead. Uh, uh, Anybody having any more questions, please?
Good, Ashok.
No?
I think we are
Okay.
at time also. A lot of people dropped lately.
Yeah, I know because they already.
Yeah.
So, uh, Dr. Wadekar, you think we can now close, or there is something else you'd like to ask?
Yeah, no. Basically, this was a good format, and
Yeah,
I tried to answer as
yeah,
as as the questions came,
yeah.
and so perfectly fine. And I hope they got something out of me.
Yeah. Another thing, actually, Dr. Wadekar has also offered to give us some guidance on the nutrition part of it. So, uh, maybe that is something which Dr.
That will
Wadekar,
be very
if you are
helpful.
free. Huh?
That will be very helpful.
Yes,
Wonderful.
Especially
it was
Yes.
really,
nutrition.
even today it was so helpful. Thank
Yeah.
you, Dr. Ji, and even the one more session with the food
Yeah.
and nutrition that will be really helpful.
Yes.
We should make it a separate session,
Yeah.
because then that will be a didactic lecture, and if it is
Yeah.
a didactic lecture, I will have proper slides and proper
Yeah.
presentation of, if you want me to address a particular type of diet, or uh, general idea about, or to deal with a diet as a lifestyle modification.
Yeah.
Because one thing which I wanted to emphasize, which I failed to mention, was that everyone tells you that you should exercise.
Yeah.
Now, the question is, what kind of exercise and how much can you exercise? If you are doing exercise for weight loss, it is a lost cause, because you consume about 12% of calories in a day from exercise, and you can only exercise so much. So by exercise, you cannot lose weight. Exercise has got other benefits, like it will make you fitter, it will prevent you from getting heart attacks, it will make your cardiac capacity better. But to lose weight with the diet, by when you want to lose weight, the only way to lose weight is zip your mouth. That is the that is the in short. But I mean, you have to, and there you have to avoid certain kinds of food, and you have to induce or include certain kinds of food, and overall total calorie restriction is much more effective. In that, I wanted to tell you that for weight loss or anything, or in general, if there is a type of which is called as a non-exercise induced uh, activity, that is NEAT, 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 and that is means you are washing dishes, or cleaning your house, or going to walking to the walking up the stairs, down the stairs, instead of using the nowadays you have got this stair lift, which they put in. If you can't walk, that is a different issue. But if you can walk, all these are come into, and 22% of your normal calories are spent in doing NEAT, that is non-exercise induced activity, NEAT. So you can easily increase NEAT because that is your day-to-day activity. But you can only exercise up to an extent, because you cannot exercise more than, say, half an hour or 40 minutes, or you can go for a walk 35 to 40 minutes or maybe an hour, but nothing more than that. So in that, you don't burn that many calories. But doing NEAT, you burn twice the amount of calories as you do with exercise. As I told you, only 12% are spent on calories are spent in a day on exercise, while 22% of calories are spent and in with NEAT. And so try to and NEAT is very easily doable, because that is your day-to-day normal living activity. That so that you if you add, that will help you much more in getting your weight down. But if you are doing it for fitness, then it is a different issue altogether, because then you have to do two kinds of exercises. One is an aerobic type of exercise, and one is muscle building exercise. So and so that is a whole chapter by itself, but we will talk about it some other time. And next time, if you want me to talk about diet, then I can specifically talk about diet, and in different scenarios related to specific diseases and in general.
Great. Okay. Good. So thank you very much, Dr. Wadekar. And I request everybody to just take care of your pending tasks and set up a meeting with me anytime you need for any further discussion.
Okay.
Sounds good. Thank you so much. Thank you, Dr. Vatikar. Thank you,
Thank you,
Ashok.
Ashok. Thank you, Doctor.
Thank
Thank you so much.
See you next week.
Bye.
Bye.